Good morning, everyone. Thank you all for joining us. My name is Jaime Perez, and I'm the Public Information Specialist for the Laredo Health Department. I'll be your MC today. Before we proceed, I'd like to take a moment to introduce some distinguished guests that are with us today. First and foremost, I want to introduce the Honorable Dr. Victor Trevino, City of Laredo Mayor. With his wife, Ms. Rosa Marquez de Trevino as well. And also representing the Laredo Public Health Department, Ms. Erica Martinez. So today we're here to bring more than a proclamation. We're here to take a stand against diabetes and to promote the resources, education, and preventative measures available to all members of our community, which is why we're proclaiming Diabetes Awareness Month in Laredo today. Without further ado, I want to introduce one of our speakers, City of Laredo Mayor, Dr. Victor Trevino. You can join us.
Good morning, Dr. Victor Trevino, Mayor for the City of Laredo. As November is National Diabetes Month, a time where communities like Laredo and across the country seek to bring attention to diabetes. It is also a time to lead by example. Diabetes is a disease that occurs when your blood glucose, of course, gets elevated. It's called elevated blood sugar. It affects about 38 million Americans, including adults and youth. I tell my patients that diabetes can be very serious and can damage the eyes, the kidneys, nerves, heart, and it's also linked to some types of cancer. For our community, it's essential to take action to prevent diabetes because we are usually leading in the country in adverse outcomes related to diabetes. This is part of a troubling trend for Hispanic population not taking advantage of preventing health services and staying physically active, which has now passed on to our youth. Now, the good news is that this is a trend that can be reversed. But it has to start with education of our public and on adapting and modifying their lifestyle, and by maintaining a healthy weight. Being overweight can make it harder for your body to use sugar and can lead to high blood pressure. Even a small amount of weight loss can help. Eat healthy. Sometimes that we don't do that. Eat smaller portions and choose food with less fat, sugar, and trans fat. Eat a variety of foods from each food groups, including whole grains, fruits, and vegetables. Limit red meats and processed meats. Exercise regularly. Don't smoke or quit smoking. Smoking can increase your risk of developing type 2 diabetes, and it also causes vasoconstriction and damage to the organs. Drink water. Instead of soft drinks with sugar like soda, Cokes, fruit punch, sport drinks, energy drinks, and sweetened teas. Reduce healthy fats. Coconut and palm oil can affect your cholesterol levels. Instead, choose healthier fat from foods like unsalted nuts, sweets, avocados, olive oil, rapeseed oil, and sunflower oil. Get checked for prediabetes. Now, prediabetes, is that an illness? It's not considered an illness, but now it's a condition that we determined prior to diabetes. If you have prediabetes, you can make lifestyle changes to prevent or delay type 2 diabetes. The key to all of this is not to fix this overnight, but by starting with people in this room. And we can start and spread it to our family, friends, and colleagues. So let's come together and take action on one of all the preventable steps that we can improve the quality of life in our community. Thank you. Now, we proceed to the proclamation?
Two more speakers.
Okay, I'll leave it here.
Thank you so much, Mayor, for those words. Without further ado, I do want to introduce Council Member for District 3, Ms. Melissa Scarroa, that joined us as well today. She's also going to share a couple of words.
Thank you. Good morning. I'm happy to be with you for this important announcement. I think diabetes is something that, unfortunately, here in our community, we see so much of. If we are not, if in our immediate families we don't have someone who has diabetes, then we certainly know of family and friends who do. It is part, we believe, of the fact that we're mostly Hispanic, and I think also there's an entire generation of our elderly who grew up in a time where being stoic and living through conditions that perhaps a younger, more informed generation of medical symptoms would understand needs to be checked, they don't always choose to go see the doctor for a lot of different reasons. And untreated diabetes, undiagnosed diabetes can be devastating. It's a condition that is treatable, but if it's not treated, then you do play havoc with your body. So these events to increase awareness, to encourage all of our population to look for those symptoms that Dr. Trevino was talking about, that we are a community that wants each other to be as healthy as can be. The beauty of this condition, or if there's a bright side to it, is that it's treatable. That there are medicines and treatments that work so that people can live normal, happy lives. And we want to make sure that everyone in our community has the ability to do that. So thank you so much to the Public Health Department for all the work that you do in making sure that our population is informed and can make good choices so they can enjoy their lives with their family and friends. Thank you.
Thank you, Councilmember, for the words. Moving forward, we are also going to have our Florida Public Health Department share a few words as well, and that's going to be Dr. Luis Selva joining us.
Hi, good morning. I wanted to provide a message for all of the people who is suffering from diabetes. Mainly, like Councilwoman said, we all know someone or we live with someone with diabetes. Laredo is hardly hit by diabetes. 18% of elders have diabetes. The incidence is way higher than any other part in the country. And so it seems to me that we are not tackling the worst epidemic of our times, which is diabetes. And so we have to be ready as a system to work with them in the almost near future. In the next 10 years, we're going to have to spend more money, more time, more efforts on treating diabetes. And this message is for them. Living with diabetes isn't about restriction. It's about discovering the delicious and nutritious foods that fuel your body. It's about learning, growing, and empowering yourself to live fully. There will be challenge along the way, no doubt. Some days might feel like struggle, but remember this, every single day is a new opportunity to make healthy choices. Every day is a chance to take one step closer to a life filled with purpose and possibility. And celebrate your victories. Every small step forward matters. Each time you monitor your blood sugar, every healthy meal you prepare, and every extra step you take is a win. Those moments add up, and they are proof of your commitment to thriving and not just surviving. So let's stand together, not just to manage diabetes, but to show the world what's possible when we face challenges with courage, determination, and hope. This is our journey, and we're making one victory at a time. Thank you.
Thank you, Dr. Selva, for those inspiring words. Next, I'm going to introduce a person that's proactive and shares his insights in his classes throughout the year here at the Health Department, and that's Mr. Homero Cantu, our Chronic Disease Prevention Supervisor.
Well, good morning, everyone. It's a pleasure to be with you as part of this event. My name is Homero Cantu. I'm a chronic disease prevention supervisor. I've been working here in the City of Laredo Health Department for more than 10 years, but working with people with chronic condition for more than 25 years because members of my family are been fighting this illness. So one important lesson I have learned over these years is that when it comes to chronic illness like diabetes, you have only two choices. Either you take control of your illness or the illness will take control of you. So how do you take control? By changes, meaningful lifestyle changes. Pay close attention to your habit. Be careful about what you're eating. Be careful about what you're drinking. Incorporate regular physical activity. Get enough sleep. Manage your stress effectively. And of course, take medication if prescribed. But please, please don't place all the responsibility for your health on medication. Your action play a significant role in managing this condition. Here in the City of Laredo Health Department, we are fortunate to have a wonderful team dedicated to support our community. If you are living with diabetes or other chronic condition, we can help by providing education and free blood work to those enrolled in our program. Please, if you want to invest in your future, the best investment is going to be invest in your health. Thank you.
Okay, now we'll move forward with the proclamation, Mayor. If the speakers can join us while we read this proclamation, Ms. Martinez.
Ready? Office of the Mayor, City of Laredo, Texas, proclamation. Whereas, with more than 38.4 million Americans living with diabetes and many more going undiagnosed, diabetes affects people across the country and remains a pressing health concern. Whereas, diabetes is a serious health condition that affects millions of individuals and families worldwide. And whereas, diabetes is the 8th leading cause of death in Texas. Whereas, diabetes can lead to serious complications such as heart disease and stroke, blindness, kidney disease, nerve damage, amputations, and more. Whereas, raising awareness about diabetes is crucial in promoting early detection, prevention, and effective management of the disease. Whereas, healthcare professionals, researchers, and organizations work tirelessly to improve the lives of people with diabetes. Whereas, according to the Places local data for better health from 2022, it has been revealed that the prevalence of diabetes in Webb County stands at approximately 16.3%. This figure is notably higher than the corresponding rates in Texas, where it is at 11%, and even more significantly, when compared to the national average in the United States, which is as low as 10%. And whereas, the City of Laredo Health Department renews their dedication to combating this chronic, life-threatening illness by standing with those living with diabetes, honoring the professionals and advocates in fight of diabetes. Whereas, the City of Laredo Health Department will continue to raise awareness about prevention of type 2 diabetes, diagnosis of type 2-1 diabetes, honoring the professionals and advocates in the fight of diabetes. Whereas, the City of Laredo Health Department encourages people to become more aware of their personal risk for diabetes and its complications, participate in healthy living, Viviendo Mejor, disease self-management education programs provided by Laredo Health, and to follow up with their care team. Whereas individuals living with diabetes deserve support and understanding in their journey to live healthy and fulfilling lives. And whereas the City of Laredo Health Department is committed to fostering a healthier and more informed community. Now, therefore, I, Dr. Victor Trevino, by the authority vested in me as Mayor of the City of Laredo, County of Webb, State of Texas, do hereby proclaim this month Diabetes Awareness Month in Laredo, Texas, and I urge all citizens to join hands in spreading awareness about diabetes, providing support to those affected, and advocating for healthier lifestyle to prevent diabetes. Thank you.